the JAMA Network.
Patients with COPD not only have a difficult time breathing, but if the disease is not managed with effective medications, there can be other health problems.
It's not a disease that just affects their lungs, it affects their body. They can end up losing a lot of weight and become very weak. They can get osteoporosis and other types of diseases.
Dr. Andrea Gershon from the Sunnybrook Health Sciences Centre and co-authors studied data from all across Ontario, Canada, involving patients 66 and older with COPD. Patients were newly introduced to 2 medication regimens. The 2 regimens were then compared to find out which was more effective at preventing COPD-related hospitalizations and death. The patients were followed until they were hospitalized, died, or until the end of the 7-year study period.
The first group we looked at was people who were on a long-acting beta agonist, or we call them LABAs for short. And we compared them to people who started a long-acting beta agonist and inhaled corticosteroid.
LABAs help open the narrowed airways, and inhaled corticosteroids work to decrease inflammation in those airways.
If they're on the combination therapy as opposed to the one medication alone, they're actually going to do better. They're actually going to stay out of hospital, and they're actually going to live longer.
The study appears in JAMA, Journal of the American Medical Association.
There were no increase in side effects, specifically pneumonia and osteoporosis, that we observed.
The study also included people who had a diagnosis of both asthma and COPD.
The incremental benefit of the combination therapy over the LABA alone seemed greater in people with a co-diagnosis of asthma than without asthma.
The combination therapy was also more effective when patients were not already taking a long-acting anticholinergic, another very commonly used COPD medication.
I think even as physicians, we prefer that patients be on less medication. But in this situation, we have an opportunity for patients to have a discussion with their doctors and to determine what's best for them.
Catherine Dolf, the JAMA Report.